Hello, my name is Jeremy Bear, one of the clinical pharmacists here in the emergency department, and I'm going to give you a quick little tutorial on the RSI box that we have in the emergency department. This is the box that they currently come in that are placed throughout different areas in the emergency department on the walls. As you go through the emergency department and look around, you will find these on the wall. Going into the box, we'll kind of go through what exactly comes in it. There will be some 10cc syringes that are inside the box with some blunt tip needles so that we can pull up our medications. The two different types of medications that are in this is we've got our induction agent, which is our sedatives, and then we also have our paralytics, and we have two different types, a depolarizing and a non-depolarizing. So the first thing that we want to kind of hit home is that we always want to sedate before we paralyze in almost all cases. The agent that's most commonly used is amidate or etomidate that will be pulled up to sedate the patient. The usual dosing is 0.3 milligrams per kilo. A lot of times we're guessing the weight of these patients, so it's an approximation. With that, you should almost always be able to pull up a dose with one vial. There is a 40 milligram, 20 ml vial in this box. So outside of that, sometimes we'll use ketamine for an induction agent as well. Because it's a controlled substance, this is something that we're going to have to prepare for and go to an AccuDose to retrieve. Moving on to the paralytics, probably the two most common ones we will use is succinylcholine, which is currently in a pre-filled syringe. It is 100 milligrams per 5 ml. The normal dosing is anywhere from 1 to 2 milligrams per kilo. I usually shoot at about 1.5. So between the two syringes, again, you should be able to take care of all of your adult population as well as the pediatric population that's coming through the emergency department. It is currently 100 milligrams per 5 ml. It's a depolarizing agent, which means that when you give it, the action potential is created and we exchange sodium potassium. So potassium is our big concern when giving succinylcholine. And some patient populations that you would think about for that would be if a patient came in with a fistula, you'd know that they're a dialysis patient, and we don't know the last time that they've been dialyzed, so potassium could certainly be an issue. So hyperkalemia, burn victims. The next paralytic we have in here is a paralytic called rocuronium. Rocuronium is probably the most commonly used paralytic we use, between that and succinylcholine. It is 10 milligrams per mil and usually dosed at 1 to 1.2 milligrams per kilo. And each vial, again, contains 100 milligrams, so you have 200 milligrams to take care of all of our population that would come through the emergency department. The last paralytic that is in the RSI kit is vecuronium. Vecuronium is very similar to that of rocuronium, but it is 0.1 per kilo, so a tenth of the rocuronium dose. So an normal adult is anywhere from 7 to 10 milligrams usually. The one thing about vecuronium is it needs to be reconstituted, and it comes with sterile water in the RSI kit as well. It reconstitutes almost immediately and very quick to be able to pull back up if you do choose to use vecuronium. If you have any questions, we are here from pharmacies here from 7 a.m. to 11 p.m. and we're more than happy to help anyone out.